As I'm sure you've heard in the news, President Macron of France has suggested a number of measures to try and increase the fertility rate of the French population. Ironically, it's actually the highest in Europe at 1.7 children per woman, but in the last year it has fallen by 7%, which is quite a significant decrease. The UK, on the other hand, has an average of 1.56 children per woman, and this is extremely low. So why is the fertility rate so low? And what can we do about it? There are many differing factors that affect fertility. The first and the most important one is age. After the age of 25, a woman's fertility decreases rapidly, and after 40, it's very unlikely that a woman will conceive spontaneously. But equally for men, fertility rate also decreases. Not as drastically, but after the age of 40, the quality and the quantity and the number of sperm decrease as well. So both of these factors combined make it much harder to have a child. So the older you are, the harder it becomes to have a child. So what you may not know is that a woman is born with all her eggs. She doesn't produce any more as she gets older. As age increases, the quality and the quantity of eggs decreases, making it much harder to conceive naturally. Furthermore, if a woman does conceive, the risk of miscarriage or pregnancy complications also increases. Another factor which greatly affects fertility is smoking. This is extremely detrimental in many aspects of health, but particularly in fertility. It impacts the quality of the eggs, increases the risk of miscarriages and ectopic pregnancies, which is pregnancies in the wrong place, but also for men, it impairs the quality of the sperm, the ability of the sperm to move, so that basically hinders the chance of conceiving. Another thing which you may not have known is that smoking affects erectile function and libido in men. Both of these are necessary to try and conceive naturally. Another factor which impairs the chances of fertility is stress. So the older you are, the more things you have to worry about, and naturally the more stressed you become. In order to conceive, the more relaxed you are, the easier it is. So again, stress is a crucial factor in affecting fertility. Another aspect that can affect fertility is obesity. In women, obesity can greatly affect your hormonal balance. So that will have a natural impact on the regularity and frequency of your cycle if your hormonal balance is messed up. Another thing that can occur is something called polycystic ovarian syndrome. This is where the ovaries form multiple cysts, and this is far more common in obese women. And generally speaking, obesity makes pregnancy harder. So if you are overweight already and then you become pregnant, it makes it harder to carry that pregnancy successfully to term. In men, obesity can again affect hormonal levels, but also levels of testosterone, the key male hormone that is absolutely necessary to try and help you conceive. An interesting fact is actually that being underweight is also detrimental to your health, particularly with regard to fertility. So we may have seen in top class women athletes, their periods are almost non-existent, because if you become extremely underweight, this means that you don't have a natural cycle. Not having a natural cycle makes it very challenging to conceive. Another factor to bear in mind is something called pelvic inflammatory disease. This occurs in women as a consequence of sexually transmitted infections earlier in their life. This damages the fallopian tubes where the eggs need to come out from and makes it very, very difficult to conceive. There also may be some anatomical considerations. There is a condition called endometriosis where endometrial tissue is found in unusual places and may result in abnormal or heavy bleeding. This can greatly impair the ability to conceive. Also, some women have anatomical variations of their uterus, which makes it physically difficult to conceive. And a common condition that women have, particularly more so in the Afro-Caribbean population, is something called fibroids. These are growths within the uterus which make it difficult to carry the baby. So, you're trying to conceive and you're not having much luck. What can you do about it? The first thing is to go and see your GP, who will carry out a thorough history and examination on both partners, the man and the woman. Fertility is not solely a female issue. Both men and women can be affected. So when you go and see your doctor, make sure that both partners go along, and he'll carry out a full history and examination and then decide what further tests are necessary. In terms of the male, they'll have semen analysis and hormonal testing, and they may have an ultrasound of the testes to see if there's any anatomical problem there. In terms of the lady, she will also have blood tests, hormonal testing, but she'll have an ultrasound scan of her uterus and something called an HSC, a hysterosalpingogram. Basically, that's a fancy X-ray in which they use dye to look at the tubes in the uterus and see if there's any sort of blockage there. So once you've had these tests, what will be done? If there's no problem found, you'll be told how to try and conceive as effectively as possible. That means having unprotected sexual intercourse twice a week at the most opportune time. And the way to do that is you can get a kit from the pharmacy and you can use this to try and monitor your progress and see the best times to have intercourse. However, if there is a problem discovered, the treatment depends on what that is. Initial method may be to try and induce ovulation in the lady. This involves taking a particular kind of medication which increases the ovulation and then allows you to have intercourse at the opportune time. Another option is then moving on to more invasive techniques, such as assisted reproduction. These are basically carried out by a hospital doctor specialized in gynecology. There are a number of different techniques available, for example IVF, IUI. These will be discussed in detail with you with the doctor. So in conclusion, fertility is affected by a number of factors, the number one being age. Then you have lifestyle issues such as smoking, obesity, stress. These are things that are well within your control to manage. Anything more complicated than that, then you should seek further advice. If you'd like to talk about this in more detail or considering having a family, do feel free to reach out to me and I'll be happy to help you with that. Make sure you subscribe to the channel and remember, true wealth is health.